Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You're watching Aging Strong, which is sponsored by the Quincy Health Department. And as you know, Aging Strong is aimed to give you information that can empower your lives, empower you so you could have really healthy, quality, independent lives. There's so many resources out there. So our goal is to be able to inform you, share with you the pertinent and most recent information. So today's topic is COPD. And I have a guest speaker who's been on the program lots of times before. She's pretty much my counterpart from from Melrose Wakefield Hospital. Her name is Joya Pizzuto. She's the community outreach nurse for Aging and Balance for Melrose Wakefield. So Joya, welcome.
Hi, thank you, Debbie, for having me. Glad to be back on.
Oh, I'm so happy to have you back on. I love your programs and your presentation. So today you're going to be talking about COPD.
Yes, learning to live with it. It's a good program. Welcome, everybody. We're going to be going over learning to live with COPD. As Debbie said, my name is Joya Pizzuto. I'm a registered nurse for Melrose Wakefield Hospital. So before we begin, I just want to make sure that everybody understands that, this presentation is really for educational purposes and should not be used as a substitute for direct medical advice from your doctor or other qualified clinician. Okay, so what exactly is COPD? So COPD, also known as chronic obstructive pulmonary disease, is a term used to describe chronic lung diseases. Most people with COPD have a combination of chronic bronchitis and emphysema, and many also have other pulmonary conditions which can complicate the diagnosis, such as asthma. And some risk factors. I don't have a slide for risk factors, but I did just want to briefly go over what those risk factors are. So risk factors to COPD are, number one is smoking. So smoking is a huge risk factor, and we will talk about that in a couple of slides. Being over the age of 40, air pollution, occupational exposure, the alpha-1 genetic disorder can cause COPD, and a history of asthma. So those are some of the risk factors for COPD. Okay, so what are some symptoms that we might see in a patient, or you yourself may see if you've been diagnosed? So symptoms include chronic cough, shortness of breath while doing daily activities, coughing up phlegm, wheezing or chest tightness, fatigue or tiredness, unable to take a deep breath, feeling like you cannot breathe, and also weight loss. And so any one of these would obviously be, a call to your doctor to go in and see what might be going on. So for COPD, there actually is currently no cure. However, the correct diagnosis and treatment, many patients can still live an active and enjoyable life. So the real goal of treatment is to control the person's symptoms, slow the progression of the disease, reduce the risk of exacerbations or flare-ups, which are very common in people who have lung conditions like asthma or COPD or emphysema, bronchitis, and to improve your ability to stay active, because obviously we want you to still be as active as possible. At the bottom of the screen, you'll notice like a little light bulb in a round green circle, and you'll see those on a couple of screens. And that is for different sites that you can go to learn more information. And so COPDfoundation.org is a really great place to educate yourself on lung conditions like COPD. And I always tell my patients that it's important to understand any chronic health condition you may have. So visiting this website, and then at the end of the slides today, there's several other resources that I can give you of accredited sites to go to that you can learn more about chronic health conditions like COPD. And that is important to make sure that you're educated. So one other thing on this slide in terms of the goal of treatment, obviously controlling symptoms, we use medications. And some of the medications that may be used are quick relief or short-acting medications, long-acting medications, corticosteroids that are usually inhaled or can also come in pill form, combination medications, so there may be a medication that does more than one thing, antibiotics may be used, vaccinations are important, and we'll talk about that at the end of this program, pulmonary rehabilitation, supplemental oxygen, sometimes surgery may be needed, and then there's also clinical trials ongoing as well. So now we're going to move on to self-management tips. So this particular program, Living with COPD, I run it in the community, and it runs for about an hour long. So for this recording for Debbie, I had to shorten the program so that we run it with enough time to ask questions and so on and so forth. So I picked out the slides that I felt were the most beneficial for people in terms of learning self-management tips. But I definitely advise, if this is a condition that you have or somebody you love has, I definitely suggest that you join our newsletter mailing list and attend the program when we run it on Zoom. We run it several times during the year so that you can get the full benefit of the program. Okay, so obviously, as I mentioned in the risk factors, smoking is really the number one risk factor for COPD. It's not the only reason, but it definitely is a huge risk factor. And you can see at the top of the screen, the little light bulb. And so a really great website to go to is smokefree.gov, where you can get all sorts of resources on how to go about quitting smoking. Because if you're a smoker and you've been a smoker for a long time, it is extremely difficult to quit. I'll openly admit I was a smoker many years ago, and it took help from my primary care doctor to quit. It took support from friends, family. It took me, revisiting my why I wanted to quit on a number of occasions, because, obviously tobacco and all of the stuff that's put in cigarettes is highly addictive. So just a couple of notes, takeaways on if you are a smoker, what are some things you can do to quit smoking? So setting a start date is obviously very important, right? So setting that start date, choosing a date and sticking to it. Maybe a special day like a birthday or an anniversary may give you that extra push to quit, right? Prepare for your start date. So, don't just choose a date like, oh, tomorrow I'll quit. Prepare yourself so that you mentally become prepared that you're going to stop, right? So change your routine so you can build up to that date. Maybe it's a week out or a couple weeks out. You build up to that date by changing your routine, if possible, to avoid times and places where you usually smoke. So if you get up first thing in the morning and you sit down with your cup of coffee and light a cigarette, and that's the way you start your day, you might want to think about changing your morning habit, right? Like getting up and maybe having a glass of water and walking around the neighborhood, or doing something different. Getting support is really, really important. So again, checking out smokefree.gov is a ton of free resources on there. There's an 800 number that you can call to get help. They'll mail you out a packet of information. It's a really great site to really set you up to win to quit. Reward yourself once in a while with something special just for you. So I know a lot of people who have quit, they put money in a jar that they might have spent on a pack of cigarettes, which I don't even know how much cigarettes go for now. I know they're like, I don't know, $10, $12. They're expensive. So if you're buying a pack of two, a day or a week or whatever, that can add up. So some people save that money and they buy themselves something special after 6 months, or they save it up for a really nice vacation to pay for, a weekend away or something like that. So doing something to reward yourself for making that commitment and being consistent about not smoking. Replacing the habit with a healthy one. So Maybe if some people just like the feel of having something between their fingers. So maybe like a celery stick, munch on a celery stick, have some sugar-free candy available. Or, make sure you have some vegetables available in the refrigerator so that you're not reaching for cookies and chips and things like that. And lastly, set yourself up to win by preventing relapses. And under the getting support, absolutely, without a doubt, reach out to your doctor because they have a whole bunch of information. There's the patch, there's certain medications that can be very beneficial. So there are ways, there are things you can do out there that can really set you up to win to quit smoking. So quitting smoking is the best way to slow down COPD if you've been diagnosed with it. So next is preventing fatigue and breathlessness. So many times people with COPD can get very out of breath, which can create fatigue and also that very breathless feeling, which is extremely uncomfortable. So these are some tips that you can do to help prevent that from happening. So the first one is to learn to pace yourself. So pacing yourself is important. Taking breaks or rest between activities. Keep a slow and steady pace to avoid rushing. It's important to rest before you become fatigued, as it will take you a longer time to recover once you get to a point of feeling overtired or all done. So really learning to pace yourself. And this is tough just for everybody in general. Like we want to get something done. We have a lot going on during the day. So the quicker we can do something, the better off we are. But you don't want to tax yourself, especially if you have COPD. So learning to pace yourself by doing things like planning ahead, right? So try not to do too many tasks all in one day. For example, avoid doing your laundry, grocery shopping, and going to an appointment all in one day, because that really, doesn't leave room for pacing yourself. It leaves room for you to be exerting yourself too much. And so really spreading out your chores throughout the week and getting help with some of them as well. Planning on rest periods. So about 5 to 15 minutes between each activity. Sit while performing tasks such as washing dishes, bathing, brushing your teeth, using a shower stool, things like that. So having a plan for rest periods. So if you are doing a little bit of laundry and housework around the house, maybe set your phone with an alarm so it reminds you that every 5 to 15 minutes, depending upon what works for you, that you stop and you sit down, and maybe that's the time that you write out some bills or you pay some bills or whatever, right? So utilizing some time for you to just regain a little bit of strength so that you don't feel fatigued and breathless. Then the next one is prioritizing your activities. So decide what is important for you to do and what can be done later. Do the activities that are most important or need to be done when you have the most energy. And also, I want to say, by prioritizing your activities, sometimes asking for help too is important. So maybe some activities need to be done by somebody else. Like sometimes house cleaning, like if you have COPD, and dusting or vacuuming can sometimes, loosen up dust and it can blow in your face, and that can be a trigger. So maybe that's something that you can leave the house and have somebody do for you so that you're not, breathing in dust as you're cleaning and stuff. And lastly, use pursed lip breathing, which we're going to talk a little bit about. But pursed lip breathing is an exercise that helps you slow down your breathing so you can inhale and exhale more air. Practice pursed lip breathing daily until it becomes natural for you to use. And believe it or not, pursed lip breathing is actually sort of a breathing technique that I talk about in a stress management program that we do for the hospital as well. It's called diaphragmatic breathing, where it's like belly breathing, but we also add in pursed lipped breathing. So, but for today, we're going to talk about pursed lip breathing, but it really works great on kind of like connecting that mind and body. Our breath is so important. So it's not just about like helping our lungs, which it does, but it also kind of connects that mind and body so that, when you feel breathless, you can feel very anxious. And that can actually help calm down the central nervous system as well. So that's good to do. Okay, so what is pursed lip breathing? I went over it a little bit just a second ago. But so again, on the screen, you'll see the little light bulb. So a really great website to go to is lung.org. And they have a great video that you can watch on pursed lip breathing. And actually, in my longer presentation for this program, we watched the video together. But for today, we're not going to do that, but you certainly can go and do it. So why does pursed-lipped breathing help with COPD? So the short answer is that pursed-lipped breathing helps bring more oxygen into your lungs and takes more carbon dioxide out of your lungs. Your airways stay open longer when you use pursed-lipped breathing, which helps clear out stale air from your lungs and your airways. So your breath rate should slow down as you start to relax. So remember, I just mentioned we oftentimes use this type of breathing even for like a stressful event for somebody who might be learning ways to manage stress. So pursed lip breathing is really great for all of us, not just for people who have lung conditions, even though that's what we're talking about today. So the benefits of pursed lip breathing is it improves ventilation, it releases trapped air in your lungs, it keeps your airways open longer, it relieves shortness of breath, and it provides a general relaxation effect on your body. When should you use pursed lip breathing? So use pursed lip breathing during the difficult part of any physical activity. And this could include things like bending, lifting, walking, climbing stairs, exercising. However, it's also a good idea to practice pursed-lipped breathing at rest or during stressful moments until the act becomes natural. And these situations may include just while you're sitting reading, so you're not really having any discomfort, but you're just practicing it so that it just becomes a natural thing. So while reading, sitting at your desk, knitting, watching TV, waiting in line at the grocery store, you can use pursed-lipped breathing very simply. So pursed lip breathing it's like a tongue twister to say, clearly, because I've stumbled on it a couple of times, but it's actually very easy to do. We just inhale through our nose, and then we exhale through what they call pursed lips. But the pursed lips actually look like you're sipping from a straw or you're whistling. So it just kind of looks like a nice inhale in, and then exhaling out. And so we just want to inhale in our minds, we think for a count of 2, and then exhaling out for a count of 4, as long as that is comfortable for you. So let's give it a try one more time. So inhaling for 2, and then exhale for 4. And that's it. That's how simple it is. You know, you could add a little ambient music to that, and you'll really be relaxing and enjoying the moment. So for sure, you can use that at any time. So how long should you do pursed lip breathing? So pursed lip breathing may take a little while before it feels natural. So sometimes it doesn't feel natural, right? To be like sitting there like, and that might not feel natural. So you have to work on it a little bit, right? Practice makes perfect. So it might take a little bit of a while to feel natural. So it's a good idea to practice a few times a day, maybe 4 or 5 times every day for at least 5 minutes, and then build up. And if 5 minutes feels too long to practice that, then start out at a minute or 2 minutes, right? And then build your way up to practicing a couple of times a day, longer and longer, right? Once the breathing pattern becomes natural, you can perform pursed-lipped breathing only when necessary. So, like I said, practice it when you're reading or, at the grocery store in line or anything like that. And then once it becomes natural and you're feeling stressed out, right, you can use it for stress, or you're feeling like, oh, I'm having a difficult time breathing, or, you need to climb a set of stairs. You want to start using it when you need it. Okay. Okay. So next is learning to relax your mind and body. So as I mentioned, we do offer a program. It's actually running tomorrow at 10 a.m. On Zoom, and it's de-stress. So it's learning ways to figure out better ways to manage stress, because stress is really never going to go away. We all have it in our lives. It's never going to go away, but there's a ton of different things, different coping mechanisms that we can use to deal with stress. But the reason why I put this slide in here, learning to relax your mind and body, is because oftentimes with COPD, that breathless feeling can create a tremendous amount of internal anxiety. It can be very frightening to not be able to catch your breath. And so learning to be able to relax your mind and body is very important. And ways that you can do it is through something called progressive muscle relaxation. So that involves tensing and relaxing muscle groups one at a time, right? There's also visualization. So give yourself a vacation by closing your eyes and imagining a relaxing scene like the beach or a walk, meandering down a path in a forest, or whatever works for you, right? And try to visualize a scene that brings peace and relaxation to you for about 15 minutes. Next is breathing exercises. So pursed-lipped breathing can absolutely be used to relax your mind and body, right? So it helps your lungs, but it's also a really great way to connect that mind and body and just kind of relax a little bit. And that is going to help you with breathing, right? And then lastly, meditation. So meditation can look like just sitting in a chair or laying in bed, and just, quietly closing your eyes and just following your breath, like just breathing in and out, no specific way. It doesn't have to be pursed-lipped breathing, but just I'm thinking like I breathe in through my nose, I breathe out through my mouth. You could even think like I breathe in relaxation, I breathe out stress and anxiety, or anything like that. And just meditation is really good. Now, oftentimes people think in terms of meditation that they need to be completely zen and nothing can be going on in their mind at all. But in fact, that's the furthest thing from the truth. Our brain is constantly thinking thoughts, thousands upon thousands of thoughts a day. It never really stops. So when you sit to do meditation and you close your eyes, you might get a minute in there where you're not thinking of anything but your breath. But then all of a sudden it'll be like, oh, I have to go to the grocery store to get some bread, or gee, I have to remember to pick up so-and-so, or oh, I have that doctor's appointment. So when you notice that your brain has wandered off, simply just bring it right back to the breath, and continue on. And then it wanders off again, and you just gently bring it back to the breath. That's how meditation works. It's really that simple. So progressive muscle relaxation, visualization, breathing exercises, and meditation are all great ways to relax your mind and body, to help deal with stress, but also to help deal with COPD, so that when you feel that anxious feeling of worrying about having a chronic health condition or feeling like you can't breathe and so on and so forth, by really connecting that mind and body, it can really help. Now, sometimes it's difficult to do on your own, like progressive muscle relaxation. I could never do that on my own. I couldn't sit here and be like, okay, let me start at the top of my head and work down. So you can you can find on YouTube, or there are a ton of free apps that you can find to put on your phone, that you can find a meditation or progressive muscle relaxation or a visualization that works for you with the way the person's voice sounds and so on and so forth. So absolutely, I say look into finding some sort of an app to use, or a YouTube video, 5 minutes, that you can do a couple of times throughout the day, to just have your brain learn that message of relaxation. And before we talk about like resources, this is almost the last slide. Let's talk a little bit about preventing respiratory infections, which is very important for all of us, but extremely important for people who have lung conditions like COPD, because a simple cold can blossom and just flare up into something that can send a person into the hospital, and it could end up with a day or two of being, in a hospital bed. So it's important to learn ways to prevent respiratory infections. So number one, obviously, is getting the appropriate vaccinations that you need, and, you can have a discussion with your doctor around what those vaccinations are. But it's very important because you really don't want to get hit hard with pneumonia. You don't want to get hit hard with COVID. You don't want to get hit hard with the flu if your lungs are already compromised. So getting the appropriate vaccinations, number one, right? Also, washing your hands often and well. So we all learned during COVID how very important it is, hand hygiene is. And it's right up there with vaccination. So making sure that we are washing our hands regularly and keeping our hands away from our eyes and, not being worrying and biting nails and so on and so forth. So that's very important. Also, you want to make sure that you avoid contact with anyone who has a cold or a flu, right? So if you know that somebody's coming down with the sniffles, you might not want to be around them, right? So that's important. And also watching for signs of a cold and flu in yourself. So that's really important, so that knowing your baseline, especially if you have COPD, is important. So if you know that you're a certain way when you climb stairs or doing certain activities, you notice that you have a little bit of breathing problems. But if you start, your baseline, and all of a sudden you're rearing off of your baseline, that's a call to your doctor. So if you notice that you're coughing up more phlegm, you notice that, I've got a little bit of a scratchy throat, right? This could be a cold, could be allergies, could be something, but let me call my doctor to make sure that maybe I can get on some kind of a medication to prevent a full onset of something else, right? So that's important so that we can catch it early. So knowing your baseline is very important. So watching for signs of a cold or flu. You also want to make sure that you call your health care provider right away if you have any of these symptoms, like a fever. So that would be, a flu, right? So a fever, a hard time breathing, a stuffy nose, increased coughing, fatigue, yellow and green mucus. Those are phone calls to your doctor because you want to make sure you get that under control, right? So. And then lastly, we're going to talk a little bit about references and resources. So I always tell, no matter what chronic health condition you have, it is extremely important to know what is actually happening within your body, educating yourself around what the chronic condition is and the things you can do to prevent exacerbations or to control whatever chronic health condition it is. So for today, COPD. So the American Lung Association is a fabulous place to research information on lung disease. So www.lung.org. So when we think about sites that we want to go to, we want to make sure that we use sites that end in .org, .gov, or .edu. Those are all sites that are accredited. So you're not just going to a .com site where some random person has come up with something that might not even be, correct. So you have to be very careful about where you obtain your information on, managing your COPD. So American Lung Association, the COPD Foundation, which I mentioned earlier, has some really great videos that you can watch. One specific one is on how to use an inhaler. So I highly suggest, because inhalers are, a go-to for people with lung conditions, and using them appropriately is important. And there's a number of different inhalers on the market today. So and it has probably 5 different videos on, the different ones. So that's important. The National Heart, Lung, and Blood Institute is another really great place to go for information on COPD and any other chronic health condition. And then, of course, the Center for Disease Control and Prevention, cdc.gov. These are all really good resources with researched information. So that's important to know, okay? So with that, I will hand it over to you, Debbie. I'm going to stop the share.
that was a great presentation as usual. And you know what? As you were talking, the very last slide with the resources, I couldn't help but think to myself, you are such a nurse. Me being only because we are so, patient education is very important, right?
Right.
So
Mhm.
we are teaching the patient the moment we say hi to them. And for you to really emphasize that people really need to know what their conditions are so that they
Yep.
can be proactive, I can't agree more. I can't agree more. And you talked about, knowing how to use the inhalers because that's one of the techniques or the patient teaching education that we usually do for patients, especially if they are new to inhalers.
Yes.
It reminded me of this funny little video that I was watching, and it was more like a commercial, but to hone in the fact that you have to make sure that whoever you're talking with really understands the proper use of inhalers. So
Yes.
the doctor was with a patient, and the patient comes in with a COPD exacerbation.
Mhm.
And the doctor says, okay, you have inhalers? And the patient says, yes, of course. And have you been using the inhalers? The doctor asked. And the patient says, yes, of course. What do you think? And so the doctor asked the patient, can you show me how you use the inhaler? Of course. So she takes out her inhaler and starts squirting it out into the air. Like this, like perfume. And that's pretty much how that little video ended. So
Yep.
bottom line is you got to know how to use it so that it will work for you. Um,
Absolutely. And I say if a doctor prescribes a medication, specifically something that isn't just popping a pill into your mouth, before you leave that office visit, you should have a clear understanding of how you are utilizing whatever it is, whether it's, you're giving yourself insulin, whether you're learning how to use an inhaler. It really should be explained to you if it's not explained by the doctor, a nurse, or a medical assistant in the office. It's so important because you really don't um, sometimes understand somebody else's understanding of something. And so it's very important. And as a nurse, education is number one. And I will always tell people, like, look, if you've been diagnosed with something, read up on it and learn as much as you can about what you can do to make your life better. So that's so important. And going to the correct websites. I wanted to make sure that that is
yes.
very important.
Yeah. Yes.
Taking advice from accredited, information that is research based.
Yeah. Yeah. Definitely asking the nurse and the doctor and also the pharmacist.
Yes, absolutely.
Yeah. Because they're the last person that, connected to your care that you would be, seeing before you start taking your medication. So definitely
Yep.
that's a great one. So I have to just say that because education is so key.
Yes.
People need to know. So I love how you talked about the pursed breathing
Mhm.
and how I never really thought about using that for stress management, but it just makes a lot of sense.
Yep.
Yeah. So I know we had the slide going on.
Mhm.
Can you do like a minute or a few seconds demo so that way people are now seeing us face to face?
Sure, absolutely. So we'll actually do a minute. That's a good idea. So I'll set an alarm on my phone just so that you can see sometimes a minute seems a lot longer than it actually is when you're doing a meditation or something, right?
Yeah.
So let's see.
And are we breathing in through the nose or
Yep.
does it?
So, well, before I start the timer, I'll just go over it again. So it's very simple. So we just breathe in through our nose. And then when we breathe out through pursed lips. And when we breathe in through our nose, it's for like a count of 2, and breathe out for double that count. So 4. So we're trying to expel the air out of the lungs. That's what we're trying to do. Just so, like I had mentioned, getting that stale air out. Okay. So let me start the clock and you'll see what exactly a minute feels like. All right. let's go. Just beginning, breathing in and out. All right, that was 1 minute. I actually feel a little bit more relaxed. One thing I did want to mention on breathing, when you do, whether it's pursed lip breathing or any sort of breathing for relaxation, you also just want to make sure that you don't hyperventilate, or when you're breathing, it should just feel natural. Right. So we're not doing anything that's going to cause us to faint or feel dizzy. And if, sometimes focusing on your breath, sometimes people do feel a little bit uncomfortable. So if you do, just stop it. That's it. So if you feel uncomfortable or you feel dizzy or anything like that, just stop what you're doing.
Makes sense. Makes sense. Can you go back? You talked about smoking, how important it is to quit smoking. And
Sure.
Definitely it's so important to quit smoking for not just to prevent COPD, but so many different type of medical
So
conditions.
many. Yeah.
You gave us steps on setting the target for quitting. Why are these steps important? Why is it important to set a target date, you think, and prepare for a target date? Can you just kind of elaborate on that a little bit, and getting the support? Why are they important?
Sure. So when we think about an addiction, and smoking is obviously an addiction, but like there's food addictions, there's drug addictions, there's alcohol addiction. When we think about that, we think about when you want to stop something. If I say, like, for some people have been known to just quit cold turkey, and if that works for somebody, then I say go ahead and do it. But for most people, they need to it becomes a ritual. It becomes like embedded in our everyday life. Smoking does, right? So it's something that, like, I light up if I feel anxious. When I get up in the morning, I have a cigarette with my coffee. When I'm driving in my car, I have a cigarette. So it becomes this habitual thing. And so stopping that habit requires us to prepare ourselves to stop. It's like you have to prepare yourself mentally to quit. So picking a date on the calendar, and then asking for support. So letting your friends and family know, your doctor know, I've quit. I'm planning on quitting, on June 30th, let's just say, for example, right? So I'm going to need your support, your encouragement. I'm going to need some accountability to stay strong, because it's an addiction and it's hard to give up. And when you give something like that up, your body, you're also physically addicted to it, not just mentally addicted. And the physical addiction can be difficult because you can physically feel things in your body. So you might get a headache from the nicotine withdrawal. You might actually, your lungs might expel more mucus. You might cough more, right? Because your body is clearing itself out. You might have difficulty sleeping, or you might sleep better without the nicotine, right? So there's different things that can happen that you need to be prepared for. So knowing those things, like, that's why I said going to that website, because it will tell you, it's normal to experience XYZ. These are the things you're going to experience. And so the physical addiction wears off about, 7 to maybe 14 days when it gets completely out of your system. And then it's the mental addiction. And so, like I said, really preparing yourself in advance so that you have the steps it takes, so that you've spoken to your doctor. They, prescribed the patch for you. They've explained to you how to use the patch. You've gone and picked it up at the pharmacy. You have it ready to go. You have, you've gone grocery shopping and you've got some healthy food in your refrigerator so that if snacking becomes a thing, which can happen, you're choosing things like fruits and vegetables, right? And making healthier choices, because a lot of times one of the reasons people don't like quitting smoking is because some people gravitate towards bad foods and then they end up gaining weight. So really setting yourself up to win. And that's why I say, set a date. Don't make it, a year from now. I mean, obviously you want to set something within a couple of week time frame and get people on board. And support is just success. Support, when you have support, it equals better success. When you have like a little fan club behind you, like, you can do it, this is good. You will, it's good for you. And you really, that whole mindset, you have to get there in terms of, because it's hard to say, I want to quit smoking. I mean, I have had patients who have been diagnosed with COPD. They're on oxygen and they still smoke. And so it's really hard. It's a really tough give up, and it's something that you really do need support around, and even learning different coping skills to help you get through that time when, like, if you feel stressed out, if you smoked when you feel stressed out, what can you do in place of that, right? Meditation, going for a walk, talking to a friend, doing a puzzle, like picking something else instead of the cigarette.
Great. I love that. I love that. It makes sense. It makes sense. So really it comes down to the person. They really need to be serious about.
Very. Yeah.
They have to be very serious and committed, knowing that it's not going to be easy.
No.
But once they make up their mind to do it, and like you said, some people can do it just overnight, like cold turkey, but other people it might take a little bit of time. And I love how you said, don't set a date next year, but rather something, much closer, like a few weeks, end of the month or end of next month, to make it more real and to have the person become more accountable. And then thinking about almost like an emergency plan, right? What if I start reaching for this? What can I do? I have carrots and my celeries, because I've known some people who have tried to quit and they gained 20 pounds. Because they said, oh, I had to do something with my hands and I had to do something. I'm so used to putting things in my mouth.
Yeah.
And then they gained weight. And that for them, yes, they were able to stop smoking, but then they gained
ads.
Yeah. So that's just like, you have to adjust to that.
Yep. Yeah, absolutely. And so another important thing to remember is, like, what is your why behind quitting? So you want to make sure it's a why that benefits you. Like, you're not like, well, I'm just quitting because my doctor told me that I have COPD and now he is making me do it. So if you're doing it based on somebody like you being forced to do it, it's probably going to be very hard to be successful. And so you have to come up with your why. Like, hey, I want to be around to see my grandkids. I want to prolong having to be on oxygen, or I want to be able to go to Europe next year, right? I want to be able to go on a trip next year and enjoy myself, or, you have to pick the why that works for you. You know what I mean? And something that really resonates within you. And another great, and keep that why nearby, like write it down on a piece of paper and keep it, make it the screensaver on your phone, what your why is. Hang it up on your refrigerator or wherever, post things around your house that are encouraging, like, you can do it, right? It's possible. People have done it before. It is going to be hard, but you're stronger. There are things you can do to get you to that goal, and definitely even joining, there are support groups for quitting smoking, smoking cessation groups, and those are great because then you're with like-minded people who are trying to quit as well. And everybody, I think what they do is they pick a date together. And so then you have more than one person who's going. So if you have friends or family members that smoke, latch on together and do it together, because then you have each other and you can create healthy plans. So you can say, hey, you know, instead of sitting in the park smoking cigarettes like we used to do, let's go to the park and walk around, right? Or, choose things so that you have that buddy system.
Yeah, I love that. Yeah, so that's good. During the day, you have the buddies, you have the support group, but then, at the end of the evening, behind closed doors, you're probably used to having a smoke after your meal or whatever.
Yep.
That's where I feel you mentioned how it's important to practice the pursed breathing, not just to kind of help you when you're having an attack, but also to help with stress management. And then you went over different stress management techniques.
Yes.
I feel like those will really come in handy when a person is by themselves. And then, they're starting to think about their cigarette, trying to use, positive habits to help them be able to replace the one that they're trying to replace is so important. So you talked about, what was it? You talked about progressive muscle relaxation, visualization, breathing exercises, and meditation. I love that. So can you, for people who's never heard of the progressive muscle relaxation, and you mentioned it's tightening certain muscles and relaxing, can you elaborate on that a little bit more?
Sure. So progressive muscle relaxation, usually you can start at the top of your head and you work all the way down to your toes. And so what you would do is, so if I started at my top of my head, I would maybe, lift my eyebrows, right? Or scrunch my face, make my muscles tight in my face, and then relax them. And then I would go down, step down to my shoulders, and I'd maybe round up my shoulders and kind of keep them tight and then relax them. And if I feel like my shoulders carry a lot of stress, that's where I carry a lot of my stress. So I feel like I walk around like this all day, even though that's probably not what I look like, but it does feel like that. So sometimes just doing that a few times. So if there's a muscle in your body that feels overly tight, you can do like tighten it and then release it. So, you might want to do that again and then release. And then, you work your way down the arm. So I'll see if I can get my arm on the screen, but I might try to make a fist and really like scrunch up my arm. Like I'm actually making a muscle. So it's tightened, and then relax, and then maybe do that again. And then, it's difficult to do like the lower back area, but you can just maybe focus on your lower back. And then if you get to like whatever if you're seated or laying down, you can think about what your back feels like resting on the back of your chair. You know what I mean? Or when you reach your buttocks, you can squeeze that together and then release. And so that's really what progressive muscle relaxation is. And I really suggest, some people can do it alone. I always say I prefer to do it with somebody guiding me because my mind wanders a lot, and I'll be like, where was I? It was on my shoulder. It was my arm. So, and a lot of people get great benefit out of that, especially at night before bed, because it's very relaxing and it can help you sleep. So absolutely choosing. So late at, after dinner can become a challenge for a lot of people for a lot of reasons, right? So overeating can become a challenge after dinner. Like you're not even hungry, but now you're sitting down to watch the latest show on Netflix, and maybe that's when you sit down with your, a bowl of popcorn if you're overeating, or, your cigarette. Oh, well, I'm going to watch the next couple of episodes of such and such. And that's when I usually light up and smoke. So when we think about that, we really think like, what can we do differently? Like if I used a straw, would that help? If I had some carrots, is it the oral fixation that I'm looking for? If I had like one of those little fidget I forget, they're like these little square things that you can fidget in your hands. If you're really just looking for something to do, would a fidget thing help you with not going for the cigarette? And sometimes we have to think like, well, I connect watching an episode with smoking, right? I connect that morning coffee with smoking. We have to change that habit. We might have to make it something different, and that's can be difficult, but not impossible. So, another really good thing outside of the meditation piece is journaling. So sometimes journaling about how you feel, like instead of reaching for the cigarette because that's what you want, journal about why you want it. How does it feel? What does it feel like to not have it, and allow your body to go through that feeling of maybe not having it, but then how fast does that feeling pass when I do something else, right?
I love that. That's a great tip. Journaling is so wonderful. There's
Mhm.
no, you can just write whatever you want, and it frees your mind.
Yes.
Frees your mind. Yeah.
Yep.
There's many different types of journaling too,
Yes.
You can just kind of Google it. There's gratitude journaling, and
Yeah. Gratitude journaling.
there's so many different ones. So find the one that's really best for you. And some
Yep.
people, they may not like journaling, but maybe they like cutting out pictures. So you can do like
Yes.
a vision board,
A
right?
vision board.
Yeah. So
Absolutely. You know what? That's actually a great idea. I might have to add that to my
Mhm.
PowerPoint presentation, because you could do a vision board of like, you know, what you'll feel like or what you'll be like when you've, cut the habit out, right?
Yeah.
So
Yeah.
that's a great idea.
Yeah.
Very
Yeah. I was just thinking about I was finishing up a program at one of the senior centers, and I had, it was an 8-week program on longevity using happiness. And I ended the program by having them journal. There's a journaling technique called Best Possible Self. Best Possible Self. And that was by Laura King, researcher, and her colleagues. And what they do is they have people journal for about 15 minutes, and they journal on what their life would be like maybe in 6 months or
Mhm.
a year or 2 years, whatever it is, but what would life be like if everything went well?
Oh, I like that.
A dream, right?
Yeah.
And so, it just basically nobody's correcting your grammar, nobody's correcting your, punctuation. You just kind of write for 15 minutes. And and you do that for about a week, and just notice, how it makes you feel, and notice the actions that you're starting to take based on what you declared for yourself in your
Mhm.
journal. So it's a nice, it's a wonderful, journaling exercise, no matter how old. I mean, the oldest person in my group was 92. So
Yeah, so that's great. Yeah.
you're never too old to dream, or to,
Yes,
unfold into another better version of yourself. So
exactly. I love that.
yeah, so it's a really, really fun. So let me just go back to one of your other slides, and you talked about, where was that? To pacing yourself, and knowing what, if you're doing any activities, stop doing that activity,
Mhm.
sitting down. And then you said, if you are writing, maybe you need to write some bills. That's a good time to maybe do it. I
Yep.
love how you were able to kind of interject a sedentary type task, so that the person doesn't feel like, oh, I'm
They're
useless
just
right
sitting
now.
there.
Yeah, I'm not
Right.
getting anything done. So I love how you're able to kind of, really educate a person to kind of think about their day, so that there's something that they could be doing productively, whether they're on their feet or not.
Exactly. And so the longer PowerPoint presentation that I do, that's the hour long, the full program, we actually do a brainstorming piece of it where people on the call pick an activity of daily living. It could be, showering, it could be house cleaning, it could be grocery shopping. And what are ways that we can make it easier? What are some of the things we can do? And so how can you pace yourself while you're doing this activity? And so that's an important thing. So that's why, if you're watching this and you do have COPD or you know a loved one who does, definitely taking that program, because we do go over a lot of different activities of daily living, like even things like people, we don't realize how taxing taking a shower can be for somebody who has issues with their lungs, so you think about stepping into a shower and, washing your hair or, washing your body uses energy and breath. And so it's important to think about what are some things that we can do, like getting a shower chair, right? Using devices that we can get to our back, taking a step back and just taking a couple of pursed lip breaths while we're doing it. So pacing yourself is important. And if there are specific things that you do a lot of, like washing dishes, maybe having like a chair that you can sit down right at the sink while you're washing dishes, or stopping, sitting down, taking a break. And then, because you still want to be able to do natural activities, right? But you just need to modify them a little bit. So, it's really good to think about the things that you do the most and come up with a little bit of a plan around how I can still do this based on giving myself time to pace and what that looks like.
Yeah, I love that. That's wonderful. So you're not angry at yourself, but rather making it realistic for yourself.
Exactly. Exactly. Yeah. There is one thing that I do want to mention before we end the call, and that is emotional, really paying attention to depression or emotional health, for everybody, but just anybody diagnosed with a chronic health condition. It can feel very overwhelming. It can feel scary. It can feel anxiety provoking, and it can feel sad. And so really making sure that you're paying attention to how you feel emotionally, and talking to your doctor about that, particularly with COPD, and some other chronic health conditions, but most specifically COPD, because one of the biggest risk factors for COPD is smoking. A lot of times people feel very guilty around the fact that they're responsible for this having happened. And then if they're struggling to quit, even after the diagnosis, that makes them feel even worse. And so really paying attention to your mental health is key. And so talking to your doctor if you feel sad, depressed, anxious, worried, and figuring out, do you need to see a therapist? Is there some medication that might be helpful for depression? Getting into a support group where you can talk with people who are feeling the same way. So if you have COPD and then you feel really depressed and you're talking to a friend who doesn't have COPD and doesn't have depression, they can listen, but sometimes it's hard for people to understand. And so it's important to talk to somebody who really understands, whether that's a doctor or a therapist or somebody who's in the same boat as you are and is like, hey, yeah, I have it. I get how you're feeling. What can we do to lift ourselves up? And so mental health is extremely important for all of us, particularly people with chronic health conditions.
Wow. I'm glad you added that, because, it's very pervasive, and sometimes it's not even talked about, that it's hard to cope with such a condition that you feel like you caused on yourself. And
Exactly.
then you're supposed to quit, but you can't. So it becomes more of a, judgment. You hate yourself even more for putting yourself in a situation. So I'm so glad you mentioned that. Yeah. So
Yes.
this hour flew by, as usual with you. This was a great topic, and I really appreciate your time. So you mentioned that there are ways that people can join your Zoom classes.
Yes.
What is the best way for people to learn more? So that way, if in case they want to learn more about stress management or the other classes that you offer so many wonderful ones. What's the best way to do that?
Yeah, absolutely. So you can reach out via email if you want. It's Aging in Balance at tuftsmedicine.org. I hope I have that correct. And you can get on our newsletter mailing list. And once you're on the newsletter, you'll be able to see all the programs that we're running. And our programs are free. We run them on Zoom, and then we also run them in person in different locations like senior centers around the community. So that's a great way to get in touch.
All right. So Joya, thank you so much again. And again, I want to thank the Quincy Health Department for sponsoring Aging Strong. Until next time, everybody, have a great day. Bye-bye.
Thanks, Debbie. Bye, everybody.